just took that out the EP car. Why don't you break down this first piece of equipment here?
This here is actually a AED.
Well, what is that piece of equipment for?
This right here is actually in case your heart stops. This helps you defibrillate it or get it out of fibrillation. So we actually have an AED. This is a Philips. This is a heart starter. And the heart starter is one of the ones that we use. We actually use a FR2 also. But this is the one we normally use because of the fact that this one's a little bit easier to actually deal with. It's automated and it walks us through everything that needs to be done. So the FR is a little bit more difficult. It's almost like an actual, like you see in the movies. It's like clear and they have the paddles and everything. It's a little bit more at that level. Here's actually the paddles of Nick. You can see they're sealed.
What about this big red bag here? Tell the people about this big red bag.
That's our medical kit right there. We have just about everything in this bag to be able to deal with any kind of medical situation. So you can see if there's something lodged in the throat, we actually can use these to be able to do that. If we're going to apply air or oxygen, if we're doing an oxygen treatment, we actually have the oxygen tanks to be able to do that. We have nasal pharyngeles in here also. We have potassium pills. So whenever you start getting a cramp or anything like that, that's what those are for. If you get a cut bigger than a boo-boo, and we need to stitch you up, that's exactly what this is. This is my suture kit right here to be able to sew people up.
Stitch me up just in case something happens.
Yeah. This is a soft T tourniquet. Brand new in the bag. We rip it. We keep them sealed until we need them, unless we're training with them. Or like this one, even this one. This blue one is actually meant for training. So you have a black one with a red tip, or you have an orange one for high vis, and the blue one is actually for training.
Why is everything in plastic?
To make sure that everything is sealed and actually kept. So kept from sterile for it not to be able to be contaminated in any way.
And if you're on a detail and this bag gets wet, you don't have to worry about all your equipment getting wet.
Right.
And have to buy everything over again.
It's nice inside of a plastic bag and it's not going to get contaminated, wet, or damaged.
So we have tons and tons of equipment that we carry with us.
This is a fanny pack one right here.
All these things are important because if you don't have the proper gear to do your said job, you in the world are hurting. Or your clients in the world are hurting. So if it takes 30 minutes for the ambulance to get there, that's a long time when your life is on the line. If you don't have all the equipment and the knowledge behind the equipment, it's amateur hour. We're professionals. We do this for a living.
That's like the nasal pharyngele. I know how to use that. Or the nasal cannula, how to attach that to the tank, how to open up the air tank, and how to administer 5, 10, 15 cc's of oxygen for 2 to 5 minutes.
If you have people with pre-existing conditions, they have heart conditions, diabetes, they might be allergic to something. Always understand, you got to invest in your training. You got to invest in yourself. How you going to carry it, how you going to transport it, all those things are so important.